Hi, I'm Dr. Kevin Smith with the Chronic Conditions Center in Bethel Park outside of Pittsburgh. And today I wanted to tell you a story about a woman that came to me for complaints about peripheral neuropathy. Peripheral neuropathy is disease or damage that affects the nerves that branch off of the spinal cord. These are the nerves that can go down the legs or go down the arms or both. There's a lot of reasons why this can occur. One of the causes is diabetes that occurs in about 30% of all cases of peripheral neuropathy. But 75% of all diabetics are eventually going to have some form of the problem. Other issues that can cause this include spinal stenosis or a narrowing of the spinal cord, a problem involving the discs like a herniated disc or a bulging disc, or maybe some arthritis or some other type of thing. It can be related to a reaction to certain medications. For example, chemotherapy that is used commonly to treat cancer can cause problems with the nerves and a lot of the neuropathy symptoms. It can also be caused from direct trauma, such as a car accident, an old sports injury, or a skiing accident or something like that. Um, some of the some of the symptoms involved with peripheral neuropathy include numbness, tingling, muscle cramps, muscle weakness, burning pain, balance problems, or your feet or hands feel too cold or too hot. You don't have to have all of these problems. You could have one of them, or you could have more than one. We had a patient, she was about 75 years old. She came to the office and she had neuropathy. Um, she previously went to her primary care physician who referred her out to a neurologist, and the neurologist did a test called a needle EMG test. That's where they insert needles into two parts of the skin, part A and part B, and then they run a current through the wires. And if her score was below the certain threshold, he's going to say, "Aha, you have neuropathy. Here's your gabapentin." So typically, when you have this problem, the medical doctors are going to give you one of three drugs. Gabapentin, also known as Neurontin, is the same exact chemical, or Lyrica, which is extra strength Neurontin. It's the same drug, and or they'll give you Cymbalta, which is it's a antidepressant. Those drugs do not cure neuropathy. They mask the symptoms of neuropathy. And typically, what they're going to do is if your feet feel like they're on fire and you have diabetic nerve pain, they'll give you a little bit of comfort on a temporary basis until the problem gets worse and worse and worse, and then they have to increase the dosage. This woman had been to all these different specialists, and that she said that the doctors started off on 100 milligrams of gabapentin. And then she went back to him about a year later. And she said, "Doc, this isn't really helping me. This isn't no longer working." So then his solution was to bump up the dose to 200 milligrams. And then she went back a year later, and then he said, "Well, you need to take this twice a day." And then that increased to three times a day. And then he increased the dose to 300 milligrams three times a day. And on and on and on it went until finally she came back to him and he told her, "Look, there's nothing more that I can do for you. You're just going to have to learn to live with it." So her balance was getting worse. She was having a lot of falls, walking on uneven surfaces like on a sandy beach was impossible. Playing in her garden was growing more and more difficult every day. And little things like getting a good night's sleep or going shopping or going to see her grandson play baseball was very, very difficult, and it was interfering with her lifestyle. So she heard about me and she came in, and I did a consultation, and then I followed up by doing a neurological examination. And what I'm looking for with these tests is number one, I want to look at the circulation. That's going to give me a really good indication about how much oxygen is being delivered to the cells. Remember, oxygen is required by every cell for normal function. And if you cut off the blood supply and without the oxygen supply to any part of the body, you're going to have a medical problem. If you cut off the blood supply and the oxygen supplied to the brain, that's called a stroke. If you cut off the blood supply and the oxygen supply to the heart tissue, that's called a heart attack. And if you cut off the oxygen supply and the blood supply to the peripheral nerves, maybe as they're going down the leg, then what happens is that the nerves start to shrivel up and die, kind of like um, a house plant that you forgot to water for a couple of weeks. Anyway, she had diabetes. She had high blood pressure, and she was taking a ever increasing amount of medications just to keep up with all the different symptoms that she's been experiencing. I did my neurological exam. I checked her circulation. I checked her sensory function. That means I checked how well that she was able to perceive sharp from dull and hot from cold, cool, vibration, things like that. Then I checked her motor function to check her deep tendon reflexes at the knees and at the Achilles tendon. And I added all that stuff up and I told her, look, this is a pretty severe problem. And she said she understood. And I started her on a course of care that involved improving her circulation and other things to stimulate the peripheral nerves to fire better into the brain so that she'd have better sensory function, better motor function. And I also gave her progressive exercises to improve her balance control. This is a long, slow process. It's not a quick fix, but it can be accomplished, and most people can get better. Um, if you're not beyond a certain threshold where if I can still help you, then we get started and we work. So she started doing some home care therapies and we did some therapies in the office. And I was working on improving the internal terrain of her body by reducing the level of inflammation, by reducing her intake of sugars and other types of things that was going to set off the diabetes and things like that. And in about 2 months, she reported that almost all of the symptoms had gone away, except for balance. That was the last thing to really improve upon. But she said that her mobility and her ability to get a good night's sleep and about ability to clean her home, to push a vacuum cleaner, and to take little trips significantly improved. And she said that this type of stuff should be offered by the medical community, but for whatever reason, I don't really understand, it's not. She continued to work with me and she continued to improve. And right now, she's about 6 months into her program, and her symptoms are about 90% gone. She's very, very grateful that somebody can help her beyond just giving her gabapentin and kicking her out the door. So if you have a problem with these issues, with numbness or tingling or pain, balance problems, muscle weakness, muscle cramping, your feet feel too cold, your hands feel too cold, maybe you're losing the dexterity in your hands, or maybe that it's becoming more and more challenging for you to get a good night's sleep, or you're having problems doing the basic stuff that everybody needs to do, like cleaning your home, or going shopping, or hanging out with your family. If that stuff is becoming very, very difficult, please give me a call and let's see what we can do for you. You can reach me at chronicpa.com. And from there, you can read a little bit more about what I do. And you can also set up a phone discovery call. That's a really great opportunity to really sit down with me and have a free conversation about your problem and what are your options. Tell me your story, tell me the things that you've already tried to do to correct this problem, and I will make my best recommendations from there. So again, that URL, that website is www.chronicpa.com. You can also reach me at area code 412-595-7332. That's my phone number. You can give me a call, and I'll be happy to talk to you about your problems. I serve the South Hills of Pittsburgh, Bethel Park, South Park, Upper St. Clair, Mount Lebanon, Peters Township, Baldwin, those type of neighborhoods. But even if you're not in that area, you can still give me a call and we can talk about your problems. This is Dr. Kevin Smith with the Chronic Condition Center. Thank you for watching this video.